Hey, one of the things that I find often with most Medicare beneficiaries, they are always confused about all the different letters. In today's video, I'm going to explain exactly what Part A, Part B, Part C, and Part D, and also, hey, you probably haven't heard about this, but Plan E, what those actually mean, and break those down for you to simplify it to make your life easy. Stick around, I'll be right back. Hey, one of the most confusing things about Medicare is all the acronyms and letters, especially when we start talking about Part C of Medicare, and then we talk about, spin that off to talk about Medicare Advantage, and then Part D or prescription drug plans, and then Part A, and we talk about hospital, and Part B and medical. I'm gonna walk you through exactly what the different letters A, B, C, and D mean. I'm also, if you'll wait around to the end, I'm gonna explain what Plan E is, which is a spin on another type of health plan that is available to Medicare beneficiaries that are 65 years in age and older, and often you don't even know what the Plan E is. So what is Part A? Part A is hospital. So as I've said many times in a lot of the videos and content, that if you watched anything, I talk about the hospital being the fixed thing that you walk into, the hospital itself. That's going to include like the bed, the jello, the nurse, the actual things that are affixed to the hospital typically fall under Part A services. So A is for hospital. Why they didn't call it H, I don't know, but it's called Part A of Medicare. So on your red, white, and blue card, if you see a red, white, and blue Medicare card, you're going to see at the bottom, it's going to say Part A, and it's going to have an effective date. Typically that corresponds to your Medicare 65th birthday month, and usually it's the first day of the month. So if your birthday is in August, it would say August the 1st, 1961, or I wouldn't say 1961 because that's when you're born, but it's going to say 2026. So it's going to have August 1st, 2026 if you're going to be turning 65 years of age and going on Part A. Your Part B is going to be underneath that. It's going to say your birth date month as well. Or if you're delaying your Part B or Part A enrollment, it's going to have the effective dates past the age of 65. So when does that happen? And why is that important? Well, your Part A and Part B is hospitalization for Part A. Part B is going to be medical, and I'm going to explain the card here in just a second. Part B is going to be medical. That's going to be anything done outside of the hospital. So your doctor visits, specialists, outpatients, diagnostics, anything done outside of the hospital falls under Part B. So again, medical is Part B. Part A is hospitalization. Now, when you look at your red, white, and blue card, your Medicare red, white, and blue card, you're going to notice that people turning 65 that are going on to Medicare, they're going to have their Part A and Part B effective dates the first day of their birth date month. Now, if you're still working and on an employer-based plan and you're suspending or not enrolling into Medicare right now and you enroll into Medicare in the future, you're going to have different effective dates as opposed to your birth date month when you turn 65. So if you wait 2 years and you're going to retire on your birth date month in 2 years because you're going to be eligible for full retirement age with Social Security, then you're going to have, instead of 8/1/2026, you would have 8/1/2028 for your Part A and Part B effective dates. So if you're looking at people's cards, typically I like to say, historically when we used to do Medicare, because people would in a sense retire at the age of 65, or they retire at 60 from maybe a state employment position, they would go into Medicare automatically at 61 or 65 years of age, because most of their full retirement age for Social Security, they became eligible for those that were from 1939 all the way up until 1960. Those people's time that they could qualify for Social Security and for full retirement age of Social Security was at 65 years of age. And then past that, we see people are qualifying for full retirement at 67. So why do I share that? Because if you're looking at the red, white, and blue card and your dates are different, it can be tied to when you came off your employer plan or you enrolled into Medicare based on an employer-based plan. Now, let's dive into Part C. Stick around, I'm going to dive into that and so much more in just a second. All right, so what does Part C mean? It's like, what in the world? You have A is hospital, B is medical, and then you have Part C. So Medicare Advantage plans, or MAPD plans, or Medicare Advantage, there's all types of different terminologies around Medicare Advantage, or replacement plans. You'll have some people on YouTube that calls them replacement plans. They're not replacement plans. They're Medicare Advantage prescription drug plans, or Medicare Advantage plans without a drug benefit called an MA plan, or a MAPD plan, or Part C. Put them in a bucket, they all mean the same thing. So when the federal government contracted out private insurance companies, which are either HMO or PPO companies or private fee-for-service plans, which are still available in certain rural areas and markets in certain states, those are private insurance companies that have a contract with the federal government. The federal government allocates a monthly allowance to that private insurance company to administer all your Part A and Part B benefits through that Medicare Advantage plan. So they're network-driven plans unless you're on a fee-for-service plan. A PFFS plan is a fee-for-service. So the doctors had to accept, or hospital has to accept the terms and conditions of that plan to use that plan. There's no network with a fee-for-service plan. It's just like Medicare. Your red, white, and blue card, if you just stay on original Medicare, you have to call the doctor and say, are you taking original Medicare? That means, are you taking the fee schedule paid by Medicare for service? And typically most doctors do, but not all doctors, not all specialists, not all hospitals. Most all of them do, but not all. So the regular HMO or PPO Medicare Advantage or Part C plans or private insurance companies that have a contract with the federal government to administer your medical and hospitalization and often the drug benefit all in one plan. And you're going to have a network of doctors, specialists, and hospitals that HMO or PPO is contracted with. Now, in the world of Medicare Advantage and Part C, there's all types of moving parts. I like to simplify this. If you're in a metro area, like we live right outside of Nashville, we often say an HMO plan typically has a large network of primary care specialists and hospitals, and often will have much lower costs and much better benefits on the HMO model plans. Now, the other thing about this is there are carriers that have national networks. So there's HMO plans that allow you to enroll into an HMO product here and actually travel to somewhere like Florida, which is an in-network state for certain Medicare Advantage carriers. I won't name the carriers, but if you take your plan and go there, you can actually look for a doctor that's in-network for that specific plan carrier with an HMO product. So if you have an ABC HMO plan here, and you take that ABC HMO plan with a national network benefit, you can actually go to other states and access care when it comes to primary care doctors, specialists, and hospitalization, and you pay the same copay typically in network here. It's an in-network visit there. So that's it's a lot of moving parts to HMO and PPOs. Now, the other thing about Medicare Advantage or Part C plans that's very important for you to understand, and you see commercials and all types of moving parts to that, is, hey, I want to qualify for one of those plans that provide me food. Well, now there's a special legislation that was passed last year, and moving forward, the only people that qualify for a food benefit or a card is those that actually qualify for chronic special needs or chronic health conditions that qualify you for this benefit. Previously, if you enrolled into a plan that had a food benefit, there may be a food benefit tied to that card, that plan, it was $50 a month or $80 a month or $100 a month, and you would be able to take that and buy healthy food choices, often meats, vegetables, and fruits. Years ago, when they first rolled this out, people were buying beer and cigarettes, and they eliminated the process, came back. Now what they've done, they passed legislation. Now people that are enrolling in these plans, you have to be chronically ill to qualify for a plan with food benefits, okay? So I'm gonna dive into a couple more details about the Part C, because the A, the B, the C, and the D, most people are the most confused about Part C of Medicare, and there's a couple more things you need to know, and then I'm gonna roll through the Part D, or D letter, and then also at the end we're gonna talk about E. What does E stand for and how does that apply to you? It's so important for you to stick around. I'll be back in just a second. So one of the other big components of a Part C plan or Plan C or Medicare Advantage plan, or if you hear the replacement plan, which is not called that in Medicare space, and nowhere in the Medicare new guidebooks or any of the certifications is called replacement, but you have people out there communicating the replacement plans. They're not. The Medicare Advantage plans with a federal contract with the federal government. They perform underneath either an HMO structure, a PPO, or a private fee-for-service structure. Okay, so we talked about HMOs. If you're in a metro area, they work extremely well because you have a huge network of doctors and access to care. If you're in a rural area, I often say look for a PPO model plan because a lot of times you're driving longer distance. And then we're going to talk about the other applications for rural options for people in rural areas. Now, if you're enrolling into a PPO plan because you've been told by the agent, hey, you have an in-network and out-of-network, meaning you can go to any doctor that you want out-of-network of the plan. The PPO model Medicare Advantage plans or Part C plans have networks with local doctors, specialists, and hospitals. Out of network, this is very important for you to understand. Out of network means you're going to pay higher cost if the doctor will accept the terms and conditions of the plan. So the doctor, the specialist, the hospital has to accept your plan. Well, guess what? Just because you're on a PPO plan and you go out of network to somebody and you walk in and you say, hey, I have a PPO Medicare Advantage plan, I want to see you, doesn't mean they accept the terms and conditions of your plan, because PPO plans still, they pay a fee for service. So doctors a lot of times out of the network will not take your plan. So what does that mean to you and how does it apply? Why am I bringing this up? Well, it's very important because one, most HMO plans have a robust network and lower cost share. And if you enroll into certain plans that have a national network, you can actually still go outside of the network, access a doctor that's in network, a specialist or hospital in network in another state, and use that Medicare Advantage plan at a much lower cost. A PPO plan, if you go out of network, out of that regional network of that plan, you're going to pay higher network cost, 40 or 50 or 60% of the billable rate, even if the doctor does take it. So why in the world would you enroll into a PPO plan, go pay 40 cents on the dollar when you could actually stay on an HMO plan, go to that same doctor or a group of doctors in that area and pay a much lower copay cost? Like a primary care doctor could be $0, $5, $10, $15. A specialist visit could be 30, 40, or 50. And 40 or 50% of a billable rate of $200 is much higher cost for PPO. So you just need to be aware when enrolling into a Medicare Advantage or Part C plan, what does Part C mean? What does C mean with Medicare? That's always Medicare Advantage or Part C plans. They mean the same thing. Now let's roll into Part D real quick. D stands for drugs, which is prescription drug plan, or which would also be tied into a Medicare Advantage or MAPD plan. A Medicare Advantage plan can have a drug benefit built into it. The Part D is the portion that covers your prescription drugs. Again, typically it's in network driven. If you're in the network area of where you're getting your prescriptions filled, if you leave that network, you typically have an authorization option to be able to get an authorized prescription filled. Let's say if you're traveling somewhere and you have to have an antibiotic, sometimes you have to go through the Part D plan to ensure that that antibiotic can be picked up at an out-of-network pharmacy. So just be reminded that when you enroll into a Part D plan or a Medicare Advantage plan with a drug benefit in it, that is all based on your medication, which is based on your formulary, which is based on a copay tier, and normally there's 5 tiers. And just because you pick up a drug plan and you say, hey, I'm covered by my drug plan, I don't take any medication. If you were to start taking medication, it's always important for you to review those drug plans based on the drug plans that are available, or review your medications based on the drug plans available to enroll in the proper drug plan for your choice. So Part A is hospital, Part B is medical, Part C is Medicare private insurance companies called Medicare Advantage plans contracted with the federal government. Part D also is private insurance companies that have a contract with the federal government to administer your drug benefit. And now stick around, I'm going to talk to you about what Plan E is and the impact it can have on those that are on Medicare. So what is Plan E? Well, Plan E kind of got rolled out a few years ago. And if you look back, it's kind of rolled out. It's kind of like a not talked about item. But Plan E actually stands for the Medicare Supplement or Medigap plans. Most of us call it Medicare Supplements, Medigap. But in the Medicare New Book, you can actually look up Plan E, and it's gonna put out beside of that it's a Medigap policy. So why is Medigap so important, or Medicare Supplement as I like to call it, so important? If you're looking at original Medicare, 11% of the population is enrolled into original Medicare, and then you will see about 52 to 54% of people are enrolled into a Medicare Advantage plan now, and the rest of the population will have a Medicare Supplement or Medigap policy or Plan E. This is the big benefit for you. If you're living in a rural area or you're in an area where you don't have access to care like a metro area, typically in metro areas, Medicare Advantage plans can be a great fit. But if you want flexibility, if you're leaving the state, coming back in the state, you have a house in Florida, a house in Arizona, and you travel a lot, you want access to care without any restrictions when it comes to doctor networks, hospitalization networks, and things like that, my encouragement would be enrolling into Original Medicare, choosing a Medicare supplement or Medigap plan. Typically, most of our clients do a Plan G or a Plan N. Most of them actually choose a Plan G, which will pay 100% of everything except for the Part B deductible. But the Plan E, if you hear Plan E, that terminology is reflective to a Medigap or Medicare supplement plan. If you're living in a rural area and you've been on a Medicare supplement plan for years and you have not done a price quote to be able to lower your Medicare supplement premium, I would encourage you to be able to look at different options. If you are still confused about the health plan options available for you and your situation, and you're confused about some of the situations that the situation you're going through right now, I would encourage you guys to be able to reach out to us. There's a link below, or you can call our office. We'd love to be able to guide you through simplifying Medicare. I would take this very complicated process and simplify it down, or one of our agents can simplify it down to make your life easy by making Medicare simple. And then also, a lot of times you're hearing advertisements or you're confused about something. Don't make a decision based out of confusion. Get clarity of exactly what you've seen or heard to make sure it's actually true and how that applies to Medicare. Dealing with a licensed professional in your area or calling us, scheduling a time. We'd love to be able to guide you through and make your life easy by making Medicare simple. Until next time, I will see you on the other side.